Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years, now doing the dental brokerage for the last 16. Today's topic is 64-year-old dentist asks, am I too young to retire from dentistry? Let's talk about this. Before we go on, as you know, we now have 10 employees. We're involved in 25 states, and we're working 363 days a year, taking off Christmas and Easter. So feel free to call us anytime, even if you just want to chat. Excuse me one second. Very bright here in New Jersey. I need my glasses, sunglasses. 201-663-0935 or nationwide dentalpracticebrokers.com. or healthcarepracticesales.com. And by the way, if you are have a large practice over $1 million with 4 or 5 operatories or more, willing to continue to work, you might be a candidate for one of the DSOs. We know who some of the better ones are, even though some of them are having trouble now. We know who the better ones are, and we can help you. Often they will pay our commission, so there'll be no commission to you, and we can help you navigate the very confusing, complex field of working with the DSOs. And also, if your practice, and we're representing you, sells for over $1 million, we'll reimburse your legal fees upon successful closing. So please give us a call. We've done that many times. Anyway, so now, how do we answer this 64-year-old? And what do we say to them? Am I too young to retire? Well, here's the answer. First and foremost, you're going to check your financials from multiple sources. Do you have enough money to retire? Or somewhat close to retire? That is, you don't have to, my opinion, you don't have to have 100% of that money ready. It could be 90%, 88%. Most CPA accountants will, they'll tell you not to sell. It's my opinion. They'll tell you not to sell and just stay the course. I don't believe in that because I'm dealing with dentists with disability, changing financial times, crisis that could occur. I'm telling you right now, if you are ready to retire and you have close to some level of financial security, or you have an exit strategy where you're going to continue working, I would absolutely just sell. Because dentistry's gotten hard. Okay, I got out 20 years ago. There was no PPO reduced dentistry. You have that now, but it wasn't back then. And I was all fee for service or indemnity insurance where I get my full fee. It's changed now. Plus the overhead is skyrocketed, the cost of supplies has skyrocketed, and insurance premium reimbursement has maintained relatively level. Well, you're going to lose money in that respect. I got hygienists making $75 an hour, one of the doctors told me, and they're getting compensated $89 an hour. It just doesn't pay, So, excuse me. Well, always be careful at intersections. Remember that when you're on the phone. It doesn't pay. So the answer to this, doctor, is if you have the financial sources somewhat close to retirement, I would get out. If you listen to your accountant, my opinion is they'll always tell you not to retire. But there's so many things that you can do as being an intelligent businessman. In dentistry, you can do fantastic in other fields, right? You don't have to be stuck in dentistry. And if you're tired of it, and you should get out. Nothing wrong with that. Or you can become a dentist working for somebody else with less pressure. You still have an income. But I would never just keep pushing yourself until you're worn out. But if you don't have those financial resources, then it's a different story. Totally different story. You're going to have to keep working or supplement your income so you can get out a little earlier than you want. I think some dentists are just miserable working for somebody, working as a dentist. They just are not happy. And you don't want that happening to you at all. If you're under that much stress, And certain dentists are under tremendous stress. Just get out. And we could talk to you about alternative occupations you could do. Anything. Just to get your life back. But more important, if you're healthy now and you have the financial resources to retire, just retire. The reason why is because every week, twice a week, twice a month, I get a phone call from a dentist that's disabled. Every single bi-weekly, so twice, every single month. Premature passing or disability. Every month for 16 years. It never ends. In fact, October 1st to November 16th was brutal. I think there was 6 incidents of disability and or premature passing. That was terrible. I don't want to see that happen to somebody's worked their whole life, you know? So, thank you.